Dear students, our topic about rickets, etiology, pathogenesis, clinical features, diagnostics, treatment, and prevention. Sunlight is a source of vitamin D. Adequate supplies of vitamin D3 can be synthesized with sufficient exposure to solar ultraviolet radiation. Melanin, clothing or sunscreens that absorb UVB will reduce cutaneous production of vitamin D3. So rickets is deficiency of vitamin D3 in organism. Reasons of vitamin D deficiency: environmental conditions where sunlight exposure is limited, like indoor confinement or walking indoors during daylight hours, may reduce source of vitamin D. Inadequate daily consumption, a lack of vitamin D in the diet, a dietary lack of calcium and phosphorus may also play a part in nutritional causes of rickets. Have trouble digesting milk products, people who are lactose intolerant. Liver failure, dark pigmentation, also reasons of deficiency of vitamin D. Problem of malabsorption, called steatorrhea, in which the body is unable to absorb fats, and they are passed directly out the body in the stool. The result of this problem is that vitamin D, which is usually absorbed with fat, and calcium are poorly absorbed. This poor absorption can be a result of digestive disorders. Steatorrhea could also lead to other deficiencies. Kidney failure, congenital or acquired kidney disorders due to tubular acidosis, in which there is an increased amount of acid in the body. Improper feeding, inadequate intake of vitamin D. For example, in breast milk, we have up to 10 international units per 100 milliliter. In cow's milk, only up to 4. Improper calcium and phosphorus ratio should be also 2 part to 1 part. Pathogenesis. Vitamin D deficiency leads to poor absorption of calcium and phosphorus and to low blood calcium level. This low blood calcium level leads to hyperfunction of parathyroid glands and to leaching of calcium from bones. Clinical signs. Rickets is a systemic disease with skeletons involved most, but the nerve system, muscular, and other systems are also involved. We have in children with rickets generalized muscular hypertonia. Craniotapes manifest early in infants. If rickets occurs at a later age, thickening of the skull develops. This produces frontal bossing and delays the closure of the anterior fontanel. In this picture, you can see babies with rickets and with deformities of the skull. Also, we can observe bow legs in form of X or O deformities, bumps in the rib cage, rachitic rosary. On this picture, you can see 2 types of chest deformities, pigeon chest and funnel chest. But nowadays, these deformities we connect with congenital defects of the chest. On this picture, you can see Rickets rosary. In the chest, knobby deformities results in the rachitic rosary along the costochondral junctions. The weakened ribs pulled by muscles also produce flaring over the diaphragm, which is known as Harrison groove. Increased tendency toward bone fractures. Because the softened long bones may bend, they may fracture one side of the cortex, green stick fracture. In the long bones, laying down of uncalcified osteoid at the metaphysis leads to spreading of those areas, producing knobby deformity. Spine deformities. Spine curves abnormally, including scoliosis or kyphosis. In more severe instances, in children older than 2 years, vertebral softening leads to kyphoscoliosis. Pain in the bones of arms, legs, spine, and pelvis, also a sign of rickets. Also, dental deformities, delayed formation of teeth, defects in the structure of teeth, holes in the enamel, increased incidence of cavities in the teeth, dental caries. Progressive weakens, decreased muscle tone, muscle cramps, impaired growth, short stature, also signs of rickets. Laboratory findings. Laboratory investigation may include serum levels of calcium, low, phosphorus, also low, alkaline phosphatase, high level, parathyroid hormone, high level, urea nitrogen, aminoaciduria, calcidiol, low level, and the urine studies include urine analysis and levels of urinary calcium and phosphorus. Clinical manifestation. Early stage usually begin in 3 months old. Symptoms of this stage: mental, psychiatric symptoms, irritability, sleepless, hydrosis, occipital belt, and laboratory findings: serum calcium, phosphorus normal or decreased slightly, AKP normal or elevated slightly, and vitamin D3 decreased. Advanced stage. On the base of early rickets, osseous changes become marked and motor development becomes delayed. Osseous change, craniotapes, frontal bossing, box-like appearance of skull, delayed closure of anterior fontanelle, delayed dentition with abnormal order, defects of teeth, rachitic rosary on the chest, Harrison's groove, pigeon chest, funnel chest, flaring of ribs. In the spinal column may be scoliosis, kyphosis, and lordosis in this stage. On the extremities, bow legs, knock knee, green stick fracture, rachitic dwarfism. On the muscular system, pot belly, late in standing and walking, motor development delayed. Laboratory findings in this stage: serum calcium and phosphorus decreased, calcium and phosphor product decreased, AKP elevated. Healing stage: symptoms and signs of rickets elevate or disappear by use of appropriate treatment. The blood chemistries become normal, except AKP that may be slightly elevated. Classification of rickets includes 3 degrees: mild form, moderate, and severe form. In the mild form, small changes of nerve system, changes of one part of the skeleton. In the moderate form, changes of all organs and systems, changes of 2 parts of the skeleton. In the severe form, damaging function of all organs and systems, changes of 3 parts of the skeleton. Treatment of rickets include vitamin D therapy. General method: vitamin D 4,000 international units per day for 4 weeks, then change to preventive dosage 400-500 international units. A single large dose for severe case or rickets with complication or those who can't bear oral therapy. Vitamin D3, 200-300 international units. Preventive dosage will be used after 2-3 months. Treatment by stages. The first stage, vitamin D dosage, 2,000 international units, 1 time a day, 30 days. In the second stage, vitamin D, 3.5 thousand international units, 1 time a day, 40 days. And on the third stage, vitamin D, 5,000 international units, 1 time a day, 45 days. Then should be used prophylactic preventive dose 500 international units till the end of the second, third year of life. We have many forms of vitamin D, but usually we use 2 forms, aquadatrim and Vigantal. Aquadatrim, 1 drop contains 500 international units of vitamin D, used to treat vitamin D deficiency or for prevention. Vigantal, 1 drop contains 667 international units of vitamin D, used also for treatment and for prevention of vitamin D deficiency. Prevention of rickets also should include some methods of correct nutrition and care. Prevention: vitamin D supplementation. In prematures, twins, and big babies, give vitamin D 800 international units per day. For term babies and infants, the demand of vitamin D is 400 international units per day. For those babies who can't maintain a daily supplementation, inject muscularly vitamin D3 100,000 or 200,000 international units. Thanks for attention.